Dr. Staggers, it's a pleasure to have you here. We're hoping to have you give us some information about hypertension and the significance of that disease and the kind of work that you're doing at the Ethnic Health Institute.
Thank you, Tony, and I appreciate that kind introduction. It's the type that my mother would smile at and my father would ask who you were talking about. But thank you for having me.
What is hypertension or high blood pressure?
High blood pressure really is the pressure that is exerted in the vessels that take blood through the body, and it's the heart pump. So part of it is the pumping action of the heart. The other is the pressure that's in the vessels. And the big thing that the public needs to remember is that it is the major risk factor for heart disease, heart attacks, and stroke.
High blood pressure is something that is pretty active in the African American community. Is that true?
A fourth of all adult Americans will have high blood pressure.
Okay, well let's...
And half of them won't know it.
Half of them won't know it.
And then African American, people who look like us, a third of them will have it.
Okay, well,
and half of them won't know it.
Can you tell our viewers some of the consequences of not having your blood pressure managed over time appropriately?
Yeah, I don't want you to leave with the impression that you have to have signs in order to have high blood pressure. High blood pressure is a silent disease. And the #1 killer in adult Americans is heart disease. And stroke comes second after that. And so the #1 risk factor, though, is high blood pressure. So it's very important that you know, not that it's normal, you want to know what the numbers are. Every patient ought to know what his blood pressure is.
Hypertension or high blood pressure is a silent killer. And in fact, people can feel well, but in fact still have high blood pressure and still have the consequences of that high blood pressure on their heart, on their brains, on their kidneys. And over time, that can produce exactly what you're describing, the heart attacks and the strokes, which are among the highest killers of Alameda County residents, Californians, and Americans.
Correct.
So tell us, now I'm concerned.
Okay.
I might have high blood pressure and not know it.
Yes.
What should I do?
So every patient ought to know what their blood pressure is, know and take it. You just can't have it one time and say, okay, I'm fine for the rest of the year. That's an ongoing thing that you need to have checked regularly.
Now, if you come in and take my blood pressure and I'm just nervous, I'm afraid I'm going to have high blood pressure, so I'm jumpy and edgy, and then in fact you tell me my blood pressure is high, do I now have a diagnosis of high blood pressure or hypertension?
No. The blood pressure changes all the time. When you stand up, the blood pressure changes. You lie down, it changes. So it's supposed to change. You get afraid, it changes, the fight, flight theory, etc. And under stress. So no, one elevation of blood pressure at any one time is not a diagnosis of blood pressure. You have to have sustained, systematic, periodic checks of the blood pressure where it's elevated, and then you get the diagnosis. It's made usually by a physician.
Okay, so now I've had several readings of my blood pressure in the doctor's office, in the church, at the local pharmacy, and they're all high. What happens next? I sit down with my doctor, and you tell me what? Depending on how high it is. If it's very high, you may need medications. Certainly lifestyle changes, diet changes, exercise, loss of weight, those things will help if the blood pressure is mildly elevated. But if it's moderately elevated, you may have to go on drugs. And then certainly if it's very high, you may have to go on a combination of drugs. And those drugs will depend on, you know, where your blood pressure is. But it starts, though, with knowing what your pressure is. Okay. Worst case scenario. Okay. I don't do any of this. Okay. And I'm at risk now for a stroke or a heart attack. What are the signs of a stroke that I need to be concerned about? The 3 simple tests that I usually tell when I was in practice telling my patients, and one was, you ask the person who says they think they have something wrong with them, you ask them to smile. The smile should be symmetrical. It should be the usual type of smile. If their mouth is twisted or they can't really get the smile, that's one sign. You ask them to raise their arms. If there's weakness and they can't raise one of their arms, that's a sign. You ask them to say, what is it that's wrong with you? A simple sentence. If they can't repeat that simple sentence, don't let that patient go for 3 hours without medical attention. You've got a 3-hour span for stroke. You ought to call 911. We're so grateful to have you, Dr. Staggers.
My
Thank you for all the
pleasure.
work you've done in the community.